the most efficient leg workout you can do after 50. Have you ever left the gym with your legs shaking and thought, wow, I really had an incredible workout today? Actually, this trembling doesn't necessarily indicate that you provided an adequate stimulus for hypertrophy. What usually happens is that many people make mistakes in choosing exercises, doing various movements that stimulate the same muscle parts, creating fatigue without the correct stimulus for growth. That's why today you'll see the only 5 exercises you really need to develop truly strong legs after 50 years of age. These exercises are intelligently designed and science-based, which will maximize your results. But before we begin, please leave in the comments your name and the city from where you're watching our content. Exercise number 5, leg curl machine. Let's start with the leg curl machine, a fundamental exercise to work the posterior thigh muscles, the hamstrings, something that few people talk about but is extremely relevant, especially after 50 years of age. The hamstrings are extremely prone to injuries because they are biarticular. This means that they cross 2 joints, the knee and the hip. Good isolated work on them can significantly reduce this risk. Additionally, strong hamstrings are essential for preventing lower back pain, as they help stabilize the pelvis and better distribute loads on the spine during daily activities. The leg curl machine perfectly isolates the hamstrings, allowing you to work this muscle group with precision. Unlike compound exercises such as squats, which also involve the hamstrings, but not in such a focused way, the leg curl machine allows you to really feel and control the contraction of these muscles. Also remember that the leg curl machine works the hamstrings in a position of mechanical disadvantage for the hip, which is excellent for complementing exercises like squats. To execute correctly, sit on the machine with your back well supported against the backrest. Adjust the support so that it is positioned just above your ankles. Your knees should be aligned with the machine's axis of rotation. When starting the movement, flex your knees, bringing your heels toward your glutes with a controlled movement. An important detail, keep your feet in a neutral position, avoiding excessive internal or external rotation. This helps distribute the effort uniformly through the hamstrings. A common mistake is using momentum, swinging the body to help with the movement. This drastically reduces the effectiveness of the exercise. Another frequent error is not completing the full range of motion. Make sure to flex your knees as much as possible without compensating with other muscles. For people over 50 years of age, I recommend 3 sets of 12 to 15 repetitions. The focus should be on controlled contraction and not necessarily on weight. Take a 1-second pause at the point of greatest contraction to maximize the stimulus. Exercise 2, squat. The squat, considered the king of exercises, works almost all leg muscles simultaneously: quadriceps, hamstrings, glutes, in addition to involving core and back stabilizing muscles. This characteristic makes it an extremely efficient exercise in terms of time and results. The squat also offers significant hormonal benefits, stimulating the production of anabolic hormones such as testosterone and growth hormone, which tend to naturally decrease after 50 years of age. This makes it an even more valuable exercise at this stage of life. Besides the muscular benefits, the squat strengthens bones, combating osteoporosis, and improves mobility and balance, reducing the risk of falls and injuries in daily life. As if that wasn't enough, it is also a powerful stimulator of cognitive function. Recent studies have shown that high-intensity compound exercises like squats increase the production of brain-derived neurotrophic factors, a protein that promotes brain health and may help prevent age-related cognitive declines. To execute correctly, position yourself with feet shoulder-width apart or slightly wider, with toes slightly pointed outward. Keep your chest up and spine in a neutral position. Begin the movement by flexing your knees and hips, as if you were sitting in a chair. Lower until your thighs are parallel to the floor, or until your mobility allows without compromising posture, and then return to the starting position. One of the most common errors in squatting is letting the knees collapse inward. Keep them aligned with your toes throughout the movement. Another frequent error is excessively leaning the trunk forward, which increases stress on the lower back region. Keep your chest up and gaze forward. For people over 50 years of age, I recommend 3 sets of 8 to 12 repetitions. The focus should be on perfect technique and not necessarily on weight. An important consideration for those over 50 years old is the depth of the squat. It's not necessary to squat to the limit of your range if it causes discomfort in your knees or lower back. Find the depth that allows you to maintain correct technique without pain. A valuable tip: before starting your main squat sets, do a warm-up set with light weight to prepare the joints and muscles. For those over 50 years old and concerned about knee health, an excellent variation is the sumo squat. In this version, the feet are wider apart and turned outward, reducing stress on the knees while still providing an effective stimulus for the quadriceps. And if you feel discomfort in your wrists when holding the bar in the traditional squat, consider variations such as the front squat or even dumbbell squat, which can be more comfortable for the upper limb joints without compromising the benefits for the legs. Exercise 3. Hip thrust. You know that feeling that your glutes have switched off after years of sitting at work? The hip thrust is the perfect remedy for the so-called sleepy glute syndrome, a common problem among people with sedentary jobs. The glutes are one of the largest muscle groups in the body and tend to lose strength and tone with advancing age, directly affecting our posture and ability to perform daily activities. What makes the hip thrust so special is its ability to isolate the glutes in a position of maximum mechanical advantage. Unlike the squat, where the glutes work together with the quadriceps, in the hip thrust, they are the protagonists of the movement. Another frequently ignored aspect of the hip thrust is its positive impact on lower back health. By strengthening the glutes, you improve support for the lower back region, reducing the risk of back pain, a common problem after 50 years of age. Additionally, strong glutes are essential for hip and knee stability, contributing to better posture and balance. This is particularly important for preventing falls, a growing concern as we age. To execute correctly, sit on the floor with your back supported against a bench, knees bent, and feet planted on the floor at a comfortable distance. Place a weighted bar over your hips, using a pad or towel for comfort, and lift your hips until your body forms a straight line from your knees to your shoulders. Hold this position for a second, contracting your glutes to the maximum, and then slowly return to the starting position. If you have difficulties, before adding weight to the hip thrust, make sure you master the movement with just body weight. A common error is not raising the hip enough, which decreases glute activation. Another frequent error is using momentum, swinging the body, instead of controlling the movement. For people over 50 years of age, I recommend 3 sets of 10 to 12 repetitions. The focus should be on maximum glute contraction at the top of the movement and on control throughout the execution. If you feel discomfort in your knees during the exercise, adjust the position of your feet, bringing them closer to or farther from your body until you find the position that allows you to activate your glutes without stress on your knees. The hip thrust also offers the advantage of being easily adaptable. You can start with just body weight and progress gradually, adding resistance as you become stronger, making it a perfect exercise for all ages and fitness levels. Exercise 4. Leg extension machine. Now let's talk about the leg extension machine, our second exercise for quadriceps. You might be wondering, why 2 exercises for quadriceps while other muscle groups have only 1? The answer is simple. The quadriceps are composed of 4 distinct muscles and represent a large part of the leg muscle mass. Additionally, after 50 years of age, there tends to be a greater loss of muscle mass in this region, making it even more important to give special emphasis to this group. The leg extension machine is a perfect complement to the squat because it completely isolates the quadriceps, something that the squat doesn't fully do. While the squat is a compound movement that involves quadriceps, glutes, and hamstrings, the leg extension machine allows you to focus exclusively on the quadriceps. An additional benefit of the leg extension machine, especially valuable for people over 50 years of age, is the specific strengthening of the vastus medialis oblique, the portion of the quadriceps located on the inner part of the knee. This muscle is crucial for knee stability and frequently weakens with age, contributing to problems such as pain and joint instability. To execute correctly, sit on the machine with your back well supported and adjust the backrest so that your knees are aligned with the machine's axis of rotation. The leg support should be just above your ankles. Extend your knees completely, without locking them, and then slowly return to the starting position. A frequent error is not making the complete movement, which significantly decreases the benefits. Make sure to extend your knees completely, but without locking them, and return until almost touching the weight plates. To maximize benefits and minimize stress on the joints, I recommend 3 sets of 12 to 15 repetitions, with a slower execution time in the eccentric phase. This increases time under tension, which, as you already know, is an extremely crucial factor for hypertrophy. Another important advantage is that, if you want, the leg extension machine allows you to work each leg individually, identifying and correcting muscle imbalances that naturally develop over the years. These imbalances, if not corrected, can lead to compensations and, eventually, injuries. Therefore, occasionally do unilateral sets to ensure symmetrical and harmonious development. Exercise 5. Calf raises. Calf raises work the gastrocnemius and soleus muscles, responsible for plantar flexion of the foot. These muscles are essential for activities such as walking, running, and climbing stairs, in addition to helping with blood circulation in the legs, acting as a second heart pump by pushing blood back to the heart. That's why, for those over 50 years of age, strong calves help prevent circulatory problems such as varicose veins and edema, common in this age group. The muscle contraction during the exercise stimulates venous return, alleviating pressure on the blood vessels of the legs. Strengthening the calves also brings significant benefits to ankle and foot health, reducing the risk of sprains and improving stability when walking, especially on irregular terrain. Another fascinating aspect is that strong calves have been associated with better Achilles tendon health, an area frequently problematic for older people. The gradual strengthening of these muscles creates a natural protection for the tendon, significantly reducing the risk of ruptures and tendinitis, conditions that can be devastating for mobility after 50 years of age. To execute correctly, stand with the balls of your feet on a step or elevated platform, leaving your heels free. Hold on to something stable to maintain balance. Lower your heels as much as possible, feeling the stretch in your calves, and then raise yourself as high as possible, standing on the balls of your feet. Maintain this position of maximum contraction for a second, before lowering again. A common error is not using the full range of motion, both in lowering and raising. Another frequent error is performing the exercise too quickly, without control. Remember that time under tension is crucial for muscle development. Do 4 sets of 15 to 25 repetitions. Calves are predominantly composed of slow twitch fibers, which respond better to higher repetitions. An interesting variation is to alternate between raises with feet parallel, feet turned inward, and feet turned outward. This allows you to work different portions of the calves, ensuring complete development. Also remember that calves are muscles that recover quickly and can be trained with greater frequency, up to 3 to 4 times a week for optimal results. Now that you already know the movements you need, you might be wondering, okay, but is there any specific order? About this, I want to make clear that I haven't presented the exercises in the exact order they should be executed. Each person adapts better to a specific sequence, depending on their particularities and objectives. However, a great tip is to start with the squat, which is the heaviest and most complex exercise of the group. But before attacking the squat with challenging loads, I recommend doing a warm-up set for each of the following exercises: leg extension machine, leg curl machine, and calf raises. Use light loads, about 50% of what you would normally use. For example, do a set of 15 repetitions on the leg extension machine with light weight, followed by a set of 15 repetitions on the leg curl machine, also with light weight, and finish with a set of 20 repetitions of calf raises. This warm-up circuit has multiple benefits. It improves ankle mobility, which is essential for a good squat, increases body temperature, prepares the knee and hip joints, and activates the main muscle groups that will be required. After this specific warm-up, you'll be ready to crush it in the squat with much more safety and efficiency. Your muscles will be more responsive, your joints more lubricated, and your technique will probably be better due to greater mobility. After the squat, you can continue with the leg curl machine to give a little rest to the quadriceps, hip thrust, leg extension machine, This time now with full load, and finish with calf raises. This sequence allows you to perform the most demanding and compound exercises when you still have full energy, leaving the isolations and less complex exercises for the end. Another valuable consideration is to adapt the order of exercises according to your weak points. For example, if your hamstrings are particularly weak or you've already had injuries in that region, consider doing the leg curl machine right after warming up and before squatting. This will ensure that you give adequate attention to this muscle group when you still have full energy, contributing to more balanced development and reducing the risk of future injuries. Over time, as you adapt to this basic workout, you may feel the need to place greater emphasis on certain muscle groups. If that's the case, here are some suggestions to expand your workout intelligently. If you want to give more attention to the glutes, you can add the hip abduction machine to your workout. For the hamstrings, the stiff-legged deadlift is an excellent addition. As for the calves, the seated calf raise allows you to work more specifically the soleus muscle, complementing the standing calf raises. However, when adding these extra exercises, it's important to consider reorganizing your workout. With 2 exercises for each muscle group, the total volume can become excessive for a single day, especially after 50 years of age, when recovery tends to be slower. In this case, the ideal is to separate the workout into 2 distinct days. For example, you can train quadriceps and calves on one day, and hamstrings and glutes on another. This division allows you to give maximum intensity to each muscle group, without compromising the quality of execution due to excessive fatigue. If you liked this, and besides legs, you want to discover a workout that will provide a complete stimulus to the chest, we have a video appearing right now on the screen. Don't miss it. Thank you for watching until here, and may God bless you, my friend.